Good morning, everybody. The Committee on Health is now called to order. Please stand for the opening prayer.
Opening prayer. Father in heaven, we commit this meeting to you. Come and reveal your will in every aspect of our lives and work. And as we discuss the affairs of this country, we ask for your will to be done. Show us your purposes. Enlighten us that we may know how and what you want us to accomplish in our task. Direct our hearts, words, decisions, and actions toward the right path and help us be on track. Let your will be done as we plan and make decisions. Amen.
Thank you, everybody. Please take your seats. Okay, thank you, Ms. Ann. Before we begin, can we can we call the roll of members, or do I hear any motion to dispense with the calling of the roll? There is a motion duly seconded. The calling of the roll is hereby dispensed, and there is an approval for the minutes of the meeting. Is there a motion that we dispense with the minutes of the reading of the minutes of the committee meeting? Do I hear anybody seconding the motion? All right, there's a motion for the dispensing and the approval of the minutes of the meeting duly seconded. This is hereby approved. Okay. So before we begin, I'd like to recognize the members that present in this committee meeting. We have Congressman Juliet Marie de Leon Ferrer of Negros Occidental, the 4th District. Honorable Samuel Verzosa of Party List Tutok to Win. Honorable Dante Garcia of the 2nd District of La Union. Thank you very much for joining. Oh, and of course our our Vice Chair, 4th District of Bukidnon, Honorable Arnie Lavin Roque. Okay. So good morning, everybody, and I'd like the ComSec to recognize our esteemed guests and other resource persons.
Good morning, Chair. Honorable members of the committee in attendance for today's meeting are the following. From the Philippine Orthopedic Center, Dr. Jose Britanio Ojalte. Morning, sir. From the Philippine Heart Center, Director Josephine Guillermo Lopez, Dr. Maria Teresa Abola. From the Department of Budget and Management, Mr. Reynaldo Moreno. From the National Kidney and Transplant Institute, Dr. Jose Marie Rosette Liquete, the Executive Director. Good morning, ma'am. Also, from the DOH, Ms. Phoebe Cabas, the Development Management Office Division Chief, and Mr. Glenn Cruz, the Development Management Officer from the Health Facility Development Bureau, and Mr. DRC Afable from the Iranon District Hospital, Maguindanao, Dr. Haris Macapegues. Morning, sir. Mr. Catalino Molina, and Ms. Elizabeth Medrano. From the Datu Blas Insuwat District Hospital, Ms. Noraya Mustafa. Morning, ma'am. And Dr. Almadin Dimaukom. From the Regional Director of the Region 1 of DOH, Dr. Sidionco. I hope, ma'am, can you kindly join us at the center table? That would be all for now, Chair. Thank you.
Thank you, Comsec. So again, to everybody, good morning to the honorable members of the committee, our distinguished guests and resource persons. The committee shall tackle today proposed measures modernizing, establishing, and upgrading of our hospitals. With indulgence of our members, upon the request of Honorable Juliet Marie de Leon Ferrer, author of House Bill number 123, we shall proceed with the billings establishing the Liver Center of the Philippines first, before items in our agenda. The first set of bills that seek to establish the Liver Center of the Philippines. The Liver Center of the Philippines is born out of a pressing need to confront the rising prevalence of liver diseases, which poses significant threats to the health of our fellow Filipinos. Today, we not only lay the foundation for this center, but also set the stage for a transformative approach to healthcare in our nation. Liver disease is a complex health concern that requires specialized attention, research, and comprehensive care. The establishment of this center is a testament to our collective dedication to provide medical services to those grappling with these conditions. We aim not only to treat, but also to prevent, educate, and empower individuals in their journey towards better health. On a related note, Speaker Ferdinand Martin Romualdez said during the groundbreaking of the 20-story Philippine Cancer Center in Quezon City last March 8, 2024, that the establishment of the Cancer Center will not only decrease mortality and morbidity, but also lessen the incidence of preventable cancers. The speaker stated that the aim is to transform cancer from a death sentence into a manageable condition that, when detected and treated early, can be overcome. The next set of bills seeks to modernize Philippine Orthopedic Center and the Philippine Heart Center. In an era marked by rapid technological advancements and evolving healthcare needs, it is imperative that our medical institutions not only keep pace, but also lead the way. The modernization of these esteemed centers is not merely an investment in infrastructure, it's an investment in the health and well-being of our fellow Filipinos. The modernization of the Philippine Heart Center and the Philippine Orthopedic Center signifies our commitment to ensuring that every Filipino has access to state-of-the-art medical care. This involves harnessing the power of cutting-edge technologies, adopting innovative treatment modalities, and creating an environment that fosters research, education, and collaboration. Also in the agenda today's meeting are 5 local bills upgrading existing hospitals and establishing new hospitals in different parts of the country. So with that, I'll actually look forward to this meaningful discussion with our House members and our resource persons, and we could begin. So first item in our agenda is the deliberation of establishment of the Liver Center of the Philippines, so we have here House Bill number 123 entitled An Act Establishing the Liver Center of the Philippines, appropriating funds therefor by Honorable Juliet Marie de Leon Ferrer, and House Bill 6324 entitled An Act Establishing the Liver Center of the Philippines, appropriating funds therefor by Samuel Verzosa Jr. So we'd like to recognize at first would be the author of House Bill 123, Honorable Ferrer, please, for your sponsorship speech.
Thank you, Chair. I would like to submit the explanatory note of House Bill number 123 as my sponsorship speech, and I would like to add that this bill is something very close to it's something very close to my heart. My mother passed away of an autoimmune liver disease 2 years ago, so this is actually one of the first bills I filed. As you can see, it was received on June 30th at 1:30 p.m. So the moment we started our term for this Congress, I filed this right away. And we do have a heart center, we have a lung center, we have a kidney center. So maybe it's about time that we also have a liver center, because I know that there are a lot of people who have liver problems, and we only have limited um, facilities and doctors who specialize in liver transplants also. I learned there were only a few of them. not like kidney transplants that we already have a lot of doctors who are specializing. So I would like to ask the committee, the members, to please support this bill because this will help a lot of people, especially now that there are a lot of liver problems. Thank you, Mr.
Thank you, Honorable Ferrer. Yes, we thank you for your very compelling and empathic sponsorship speech. And next is House Bill 6324, entitled An Act Establishing the Liver Center of the Philippines and Appropriating Funds Therefor, by Representative Sam Verzosa Jr. Honorable Verzosa, your sponsorship speech.
Maraming salamat, Mr. Chair, at maraming salamat po sa pagkakataon na maipresenta ko po ang aking bill tungkol sa pagpapatayo ng Liver Center of the Philippines. Gaya nga po nung nasabi ay meron na po tayong Lung Center, National Kidney Institute at Transplant. Meron na rin pong Heart Center at Philippine Children's Hospital. At kanina po, masaya ako dahil nadaanan ko po at nakita ko yung pinapatayong National Cancer Center of the Philippines. Kaya po ngayong araw ay gusto ko po sanang ihikayat ang ating mga resource person at members of this committee para suportahan yung pagpapatayo ng Liver Center of the Philippines. Isa po ang mga liver diseases sanhi ng kamatayan, hindi lang po sa Pilipinas pero sa buong mundo. Ako rin po saksi at naranasan ko din po yan dahil last year din po sa kasamaang palad na wala rin po ang aking ama due to liver disease. Kaya malapit din po sa aking puso itong bill na ito. Kaya po hinihikayat ko po ang suporta ng ating committee at ng ating mga kasamahan dito na makapagtayo tayo ng Liver Center of the Philippines sa ating bansa. Yun lang po, Mr. Chair.
Thank you, Honorable Verzosa. We understand the urgent need to actually establish this liver center in the Philippines. I believe that liver disease is supposed to be one of the top morbidity rate diseases in the Philippines, so it's just about time that we actually address this concern. And first off, in our resource persons, we'd like to call on Ms. Phoebe Cabab, the Development Management Office for Health Facility Development Bureau of the DOH. Ms. Cabab.
Good morning, Mr. Chair and everyone. The DOH supports the intent of the filing of the establishment of the Liver Center of the Philippines, and we need to further study to aptly identify the projects and the health facility needs on expanding this establishment of specialty centers to cover other burdens of diseases. While DOH acknowledges the burden of the liver diseases in the country, we have these following comments and recommendations for this House bill. First, the upgrading of the existing public hospitals to accommodate specialty centers would be more cost-effective and time-efficient. Constructing single specialty hospitals demands more time and resources compared to enhancing existing facilities. Further, establishing a new hospital requires legislative approval and progresses in phases before offering tertiary specialty services. Secondly, the proposed specialty hospital should be established as a DOH facility rather than a corporate entity, as this would ensure greater access to subsidized services for the public. Furthermore, the corporate entities rely on a hospital-generated income, which may not always be a guarantee to financial sustainability. Section 8 of the Program for Indigents include financially incapacitated individuals, since not all eligible patients availing the malasakit program are classified as indigents. So this is respectfully submitted as our position. Thank you very much.
Thank you, Ms. Cabab. So up next on our resource persons is Dr. Rosemary O. Rosette Liquete, Executive Director of NKTI. You're recognized.
Yes, sir. Good morning. Sorry. Good morning, everyone. The Honorable Chair, Honorable Reyes, and of course the the proponents of these bills, Honorable Sam Verzosa and Juliet Marie de Leon, and Your Honors. Um, I would like to say that we of course support, as a DOH, we support also this position paper of the Department of Health. However, I have also prepared something from the NKTI, being the lead center for organ transplantation. So when the 17 specialty centers were recently approved, there was no liver center. So I said that should be included. So that's why we had TW meetings under the DOH regarding this liver center. And true enough, then we have these bills which will also be supported by this TWG meeting that we had. So I agree with the creation of the liver center to provide a state-of-the-art diagnosis, management, treatment of these diseases, training and researches pertaining to liver disease treatment, including cancer detection, screening, but not the transplant in that center itself, which is actually the mandate of the NKTI as the lead center for organ transplantation. It will be cost effective to be integrated with NKTI as we have already the facility of an organ transplant center, state-of-the-art equipment, the manpower, immunologic tests, which are very expensive. We can study the pharmacokinetic of immunosuppressions or the drugs that we use. We have the facility for possible stem cell, as you have mentioned, studies and other researches. As a backgrounder, I also will give you a position paper on this. For brevity, in 1981, Presidential Decree 1832 created the National Kidney Foundation of the Philippines. And then in 1986, with the changing of the names of various government hospitals under the jurisdiction of then the Ministry of Health, diba, uh, after this EDSA revolution, the NKTI was renamed National Kidney Institute. Then came the significant milestones in the field of transplantation, not only in the Philippines but also in Asia, spearheaded by the National Kidney and Transplant Institute. The first simultaneous kidney pancreas transplant in Asia, the first liver transplant in the Philippines, 1988 yon after the 1986 change, and the first kidney and liver double transplant in 1990. Thereafter, Republic Act 8020 in 1995, having this significant milestones in the field of transplantation, was the changing of the name of the NKTI to National Kidney and Transplant Institute. So the NKTI, Section 1 of this RA 8020, is hereby renamed as the National Kidney and Transplant Institute and shall be designated as the lead center for organ transplantation. Transplantation has become the greatest modality in the treatment not only of end-stage kidney disease, but also for other end-stage abdominal organ diseases or failure. The liver, the pancreas, and we can even have now the small intestines. Yes, the liver center ought to be where the specialty centers are, but it doesn't mean that it ought to be in a separate building. And to be more efficient, maybe within the NKTI, or I don't know if the lung center would agree, a parcel of an area in proximity to NKTI. As to the hospital structure of NKTI, we are a recipient of a legacy project from the national government, which I believe the Congress you will also support. So we will have that legacy building, which will house 200 plus hemodialysis machines with provision for training facility for doctors and allied health professionals. We will have an NKTI academy. So it will be a 12-floor structure. In this juncture, the National Liver Center can be included in the said building by designating some floors for such purposes. So it will be a strategic step to integrate National Liver Center inside the NKTI compound so that ancillary medical or hospital services will be within its proximity, no? Such as the laboratory, radiology, and patient units. And also NKTI is also for other organ transplantation, which includes not only the kidney but other abdominal organs. So it will be cost effective to be integrated. In short, we can collaborate. Actually, we have a liver clinic in our hospital, which we have formed, and we have done several transplants already on liver. And currently, we are crafting a MOA with the Philippine Children Medical Center, wherein they also have a renal center, but they will do the kidney. They will have our kidney transplants at NKTI. Likewise, for the advanced end-stage liver patients of PCMC, they will also be performed at NKTI. Well, others I have just mentioned here in the section 3 of the bill that you have presented. And in section 3, letters F to K, they're rather vague and they need to be rewarded, I'm sure. But because it's not possible to recruit liver donor just like that, even for kidney, it's not possible. There will be regulations against organ trafficking and allocation criteria to be followed in case of organs coming from deceased or brain dead donors. So, ladies and gentlemen, your honors, that's a position of NKTI. Of course, we are Department of Health also, and I believe we have only one voice. Thank you very much.
Thank you, Dr. Rose. Before we proceed, we'd like to recognize the representative of the 1st District of Taguig Pateros, Congressman Ricardo Cruz. Congressman, good morning. So, any other resource persons that wish to participate? Okay. I believe the DBM is here. Mr. Rinaldo Moreno, would you have any insights with regards to the proposed bill?
Magandang umaga, Mr. Chair and the honorable members of this committee, sa mga kapwa po panauhin at kapwa kawani po ng pamahalaan. Magandang umaga po sa lahat. Ang kagawaran po ng budget at pamamahala ay kinikilala po yung intention po ng panukalang batas sa pagbibigay po ng pansin sa mga issue o tukol po sa liver. So generally we support the intention of the bill. However, considering po the statement made by the or the comment made by the fellow colleagues from the Department of Health, we defer to them on the establishment of the liver center. However, if the creation of the said center will be pushed through as a GOCC, may we note that pursuant to RA 10149, research institutions are among the those excluded from the coverage of the Governance Commission for GOCC. Ibig pong sabihin, kung makikreate po ito as GOCC at isang research institute, ito po ay magiging bahagi po under po ng supervision po ng DBM in terms po sa kanya pong mga organizational structures and compensation. Sa makatuwid po, minumungkahi po namin para po maging align po ito sa iba pang state-run specialty hospitals, they should follow po the SSL. Ang amin pong talagang major concern dito ay yung provision po on the appropriation and income retention. So, consistent po sa position ng NEDA, DOF, DBM sa amin pong naisumite sa Speaker at sa Senate President. No? Unang-una po, we discourage po the earmarking of funds. That's number 1. Number 2 po, sa income retention, ito po ay hindi align sa pinapromote po nating one-fund policy. Kaya po, on the DBM side, we discourage po the earmarking and the income retention. But definitely, we support po and we laud the intention of the bill and the proponent of this proposed measure. That's all, Mr. Chair. Thank you.
Thank you, Mr. Moreno. We also have here the Government Procurement Board, representative by Mr. J. Mar Bareng. Mr. Bareng, you're recognized.
Good morning, Mr. Chair. Good morning, everyone. For the GPPBTSO, while we are currently finalizing our comments on the proposed bills, House Bill number 123 and 6324, we would like to manifest our support to the the intention of the bill. And on Section 11 of both bills, we wish to note that in the acquisition of real properties and disposal of government properties, we wish to note that Section 4.4A of the 2016 revised IRR expressly states that this IRR shall not apply to the acquisition of real property, as this shall be governed by RA number 10752, or the Right of Way Act, and other applicable laws, rules, and regulations. Moreover, Section 4.5F of the same revised IRR provides that disposal of property and other assets of the government is not a procurement activity under RA 9184 and its IRR. Instead, the revised manual on the disposal of government properties and other applicable manuals on the disposal of real properties shall apply. That's all, Mr. Chair. We will submit our position paper on both bills po as soon as possible. Thank you.
Thank you, Mr. Bareng. I believe the representative or the president of Hepatology Society of the Philippines, Dr. Jeneline Agkawili Conde, is here. Madam, you're recognized.
Good morning
Board
to
Secretary.
everyone.
Board
I'm Dr.
Secretary.
Jenilyn Nagkawili Conde. I'm one of the officers of the Hepatology Society of the Philippines. So we would like to express our gratitude to the board, to the Congress of having recognized and to have this bill 123 to hopefully to be at law. As we know, in the Philippines, we have a lot of cases of liver cancer and even liver cirrhosis. And it's really very timely. Liver cancer, as we know, is fourth most leading cause of cancer here in our country, and a lot of deaths has been happening. Almost 2,500 new cases of liver cancer, and even 9,953 deaths in 2020. So can you imagine how many Filipinos are suffering with liver cancer and even for liver cirrhosis? And in latest World Health Organization, still Philippines has the highest number of cases of chronic hepatitis B compared to other Southeast Asian countries. And in Western country, actually hepatitis or viral hepatitis is not anymore their problem. And now the arising or the silent pandemic of what we call metabolic associated fatty liver disease. And fatty liver disease can also lead to liver cancer and liver cirrhosis. So it's really very important to have this liver center. Thank you, sir.
Thank you, ma'am. All right. Thank you. If that would be all, we wish to open the floor to any of our members who wish to ask questions from our resource persons.
Mr. Chair,
Yes?
I would like to answer or comment on
Yes.
each of the resource persons.
Please go ahead.
With regards to DOH, Ms. Habab, you mentioned that you require legislative approval for the establishment of. That's why we are here actually, because we are actually trying to pass this law because we want the liver center of the Philippines to get legislative approval. So that's why we're here. And I don't think updating existing facilities, hospitals I mean, is enough. There should be a liver center which will specialize in the liver disease. However, I agree with Dr. Liquete that maybe since the kidney and organ center of the Philippines already has the facilities, maybe we could put the building of the liver center right beside the NKTI or the lung center so that they'll be in the same compound and they can coordinate. So there will be some tests that will be done there, and maybe the new building will have more facilities that they can share also with other needs of the NKTI. That is actually a very good idea. I don't know if there's enough room in the compound. Maybe you can ask Dr. Liquet.
Yes, thank you for that, Your Honor. Actually, we are only a 5.8 hectare, but then our Tabor has 12 hectares, right? The lung center of the Philippines. So that's possible also. So we can have common facilities.
Yes, that's
Yes.
a very
Um,
good idea.
But then I also presented, this one is a legacy project, which shall be, of course, be, I'm sure, approved, no? Itong legacy project nito. Because it's intended for a hemodialysis center. But we were all asking only for 5 floors. And then legacy said, oh, you make it, you maximize the space in your small NKTI, make it 12. So then it's gonna be 12 floors. So I believe if there will be a liver center within that facility, which I hope the legacy people or the one who proponent of this would agree, isa na lamang tayong building because that's 12 floors already eh. We were only asking for 5 floors. So we can just rearrange maybe the, the proposed offices that we said, okay, we will put on everything that we have there because we also want offices for our administration. So, if that will be possible, it's very strategic in terms of
Mr. Chair,
manufacturing.
may I ask what other offices will be housed in that legacy building, Mr.
Well, since we are going to have, it's mainly kidney, the dialysis. But then, since we are also in training, we will have the academy, NKTI Academy. So we can also absorb all these trainings for the liver. Actually, we have a liver clinic, a liver sort of small center, we can say, no? Because we also see patients' liver cases at NKTI. We have also um, pathologists in our center. And then that's why we also have an active liver transplant. Mm-mm.
That is a good suggestion, Mr. Chair, but I think uh, I would like the liver center to be a building on its own, just so that it will emphasize the importance of the liver disease. And as Doctor, I'm sorry, from the hepatology, Doctor
Dr.
Alkawili,
Yes, ma'am.
Conde.
yes, said that it is the fourth
Most
major
leading cause of death.
fourth cancer, fourth
Fourth leading cause of
yes.
cancer po, and second
So-
leading most common cause of death, cancer po.
So, but that's a good idea that it'll be in the same compound. And then next, my third one is DBM. Of course, DBM will always object, Mr. Chair, to any budget or appropriations provision in any of our bills. That's a given. But I'm willing to compromise with regards to the wording and to the details as long as it conforms to the existing laws. And then with regards to the government procurement word, the same thing. I'm okay with revising that provision so that it'll comply with the existing laws and rules and regulations. And then lastly, the Hepatology Society of the Philippines, I would like to thank you for your support, and we hope that this will really materialize and this will happen within our lifetime because I think it's also important that we give also importance to the patients, the liver patients. But in legislation, it's always we start from here, but there's always room for improvement. So the bills that we have, we can, as you said, as the DOH, NKTI said that it is some of the terms are big, and we are willing to expound on the definitions, on the role of the new liver center. That's not a problem. That will be more of the details of the bill. So it's I'm happy that there is support for the bill, at least in principle. With regards to the details, that can be worked out, and I don't think there is a problem with regards to amending or changing some of the wordings in the bill, Mr. Chair. That's all, Mr. Chair, and thank you very much for the support.
Thank you, Congressman Ferrer. Before we proceed, we'd like to recognize a member of this committee from the Lone District of San Jose del Monte City, Congressman Florida Rida P. Robes. Good morning.
Good morning, Mr. Chair. Mr. Chair, allow me to say something. I would just like to make manifestation of support. Of course, I'd like to make a manifestation with this bill because it's actually needed. When you go to UCLA, there's a lot of people who's really suffering of liver cancer. So even in Singapore, so I guess in the Philippines, though we're a little bit naiiwanan, I don't think so na last na yon. I mean, wala tayong magagawa. With this kind of bill, I just hope it could be considered with the request of the honorable chair, honorable friend of ours, na makasama talaga. It's not just a building itself. Kasi sabi nila R&D, yeah, it's good. We could have a research and development center. But of course, ang hahanapin nila after the R&D, what's next? So you already have it there. I think you just really have to make it work talaga para yung may hope naman, may pag-asa po yung higit sa lahat yung mahihirap nating kababayan. Most of us here are really for the social justice na yung mas mahihirap nating kababayan ang mas mabigyan ng pagkakataon na magkaroon ng dagdag na buhay. Yun lang po, Mr. Chair, and like to make my support with this, extend my support to this. Thank you.
Thank you, Congressman Rodriguez. I actually am in support of this bill, and I was hearing some of these. I'm sorry, is there any other House member that wishes to?
Mr. Chair,
Go ahead.
one more question for Dr. Rose Liquete. Dr. Liquete would like to ask, how many operations do you perform in the National Kidney and Transplant Institute regarding liver cases po or transplants?
For the liver transplant, because of the paucity of deceased organ donors. For the adult, for example, we need the whole liver, so we source it mainly from deceased or brain dead patients. That's why we also have to push on our organ donation program. And then last year, for example, we had only four. We had
Only four.
four from the deceased donors. But we are embarking on getting livers from related donors. We're in a segment of the liver for the smaller kids, for example, or the right lobe for the bigger,
How
for
about
the adult, yeah. Segment also of the
Dr.
liver.
Liquete, how about for other liver operations other than liver transplant po? Around how many operations do you perform?
For you mean the hepatobiliary operations?
Other than the liver transplant po.
Yes,
So there's so
other than the
many
liver.
liver
So
cases.
I would say maybe two a month or 3 a month.
2 to 3 a month.
Yes. For major liver surgeries.
Yes, Dr. Liquete, as our other research person has said, the liver cases po and liver cause deaths po are the fourth major po sa Philippines. So kung paapat-apat lang po at minsan wala pa tayong liver transplant, sa tingin ko po kinakailangan talaga natin magkaroon ng Liver Center of the Philippines kasi po libo-libong kababayan natin
Yes.
na may problema. Gaya nga po ng nangyari sa akin, yung ama ko po ay kinakailangan pa pong ma-operahan abroad at mapalad ho kami dahil kaya namin yan. Ang problema po ay para sa mga kababayan nating salat at hirap at may matatakbuhan sila dito po sa ating sariling bansa. So kaya po natin pinupush na magkaroon ng Liver Center of the Philippines para po sa mga kababayan natin at sa mga nangangailangan po talaga ng immediate na sasagot sa mga problema nila at hindi na nila kailangan mag-ibang bansa pa po. At sa tingin ko po, pag talagang ginusto natin sa Kongreso at ng gobyernong ito, kakayanin naman po na magkaroon ng sariling Liver Center of the Philippines. Gaya nga ng pagkakaroon ng Cancer Center of the Philippines ngayong taon lang po.
Yes, Your Honor. Actually, the problem of our health institution is that we have very poor screening of our patients. No, for example, recently I had 2 patients with cancer, liver cancer. But what can I do when these are already late? These patients, you cannot operate on these patients. So most of our liver cancer patients, they come in late. It's not resectable anymore. Beyond the criteria na namin yan, ano ba ang resectable, no? And it's not even, this patient is not even transplantable. So that's why, as a national specialty center, we get all these cases as the end-stage referral of these diseases. But of course, when it comes to prevention, and then your screening, and then these are mainly medical cases which can be handled by the liver center. What we are saying is that when it comes to transplantation, no, of course, cholecystectomy, almost every day meron kami. That's also liver, ma'am, di ba? Marami tayo doon. Minsan, 3 sa isang araw. Sa NKTI yan, ha? We're not only the kidney, but the main liver surgeries, yes, it can be done there, and the transplantation. But I give you that for your liver thing at the center, yung prevention natin, for example, we have done this resource stratified framework for renal care. I have here Lercy, our proponent for this also. Ganon din ang gagawin natin sa isang liver center. Hindi naman na pupunta na agad sa liver center, nasa sa Manila ang isang pasyente. They can go to the local LGUs na pwede rin silang gagawa ng specialty or liver center within their hospital. Ganon din ang mga renal gagawa din sila ng renal centers. But they need not go right away to the tertiary hospitals in the region because meron ka na doon prevention and all these minor liver surgeries. But when it comes to transplant, yun lang sinasabi namin, you have to go to the National Specialty Center. That's what we aim for. Siguro yung mga cholecystectomy na yan, we can divert the patients already to the regional, to the provincial. They can do that already. Yes. But for major, the end stage talaga is the lead, the NKTI is the lead organ.
Opo, Dr. Liquete, maraming salamat po sa information na yun. So gaya nga po ng sinabi nyo na kayo na po yung end stage na napupuntahan ng mga pasyente. Sa tingin ko po, yung pagkakaroon natin ng Liver Center of the Philippines will spread awareness sa ating mga kababayan na meron na tayong specialty center for livers para mapuntahan ng mga kababayan natin at confident sila na nandun talaga yung mga eksperto, maraming researchers, marami tayong mga espesyalista na kayang matugunan at an early stage yung mga sakit nila. Yes. At hindi na po matagalan pa at makulang ng oras po sa pagpunta sa mga hospital. Yun lang po, Mr. Chair, maraming pong salamat.
Thank you, Honorable Verzosa. If I may add my insights into this, the purpose of actually having these bills here, particularly the liver center, is when we do this, it institutionalizes already the center and ensuring that we actually have it earmarked in our budget. I know DBM has some opinions with regards to how we do this, but we have to look at it in the nature also of what keeps the state or what keeps the country or its citizens productive. It has to be because of the health of its citizens. And having the liver center institutionalized, I understand, Dr. Rose, that you were, instead of 5 floors, you were given 12 floors. I believe also that we have to look at it not only because of its present capacity or need, but also anticipating the future needs of the particular center. Having this institutionalized and appropriating the certain funds for any infrastructure centrally should also be part of the anticipating need of addressing liver disease. If the Hepatology Society of the Philippines' data is correct, we see this actually as almost probably in epidemic levels already soon, given the kind of lifestyle and culture and our dietary behaviors here. So it would be appropriate that we really have this institutionalized in one way or another. I'm not so sure if we will put it in a GOCC form or if we will put it under the OH. in either way by having it maybe in the same structures, either the specialty centers like the lung center, the kidney center under the DOH, we could be guaranteeing the funds. We already have the Regional Specialty Centers Act, wherein we could include liver the study of the liver diseases to be included in the regional specialty centers. If early screening is actually one of the ways on how we could prevent end stage liver disease, so that we do not have to keep on transporting them to Manila to conduct these extensive and expensive operations, not to mention that some of it is also dependent if there is a donor. We still do not have the technology to actually grow these kinds of organs yet, although I do believe that maybe soon there will be. But as of now, we are so much donor dependent on these kinds of operations. But having it early screening in our regional specialty centers that we have just approved and synchronized with our plan for the universal healthcare law, wherein I believe that we are supposed to be promoting preventive healthcare, where early screening that is supposed to be shouldered by the government is PhilHealth around. That PhilHealth is supposed to cover for it also, is will prevent the need to actually bring them there. So by doing that, we have these escalation procedures on how we are able to treat these certain diseases, whether it be for kidney disease, for liver disease, lung disease, heart disease, but having this capacity institutionalized in our healthcare system will be actually should redound to the benefit of the Filipino people. So that's my take on this. And anybody else that wish to?
Mr. Chair,
Yes, Congressman Roque.
I'm just curious, considering that to Dr. Rose Liquete, Doctor, I'm curious, considering that you have a 12-story building and only 5 of the floors are being occupied, what have you been doing with the rest of the floors that are not even occupied?
We don't have the building yet. After this national cancer, we will have a groundbreaking already. Not yet, but after soon, just like the National Center for Cancer, nag-groundbreaking na sila. And then next us. Actually, we only was asking for a 5th floor because we thought that there is a limitation on the height of the building around the elliptical. But then we asked from the office of the mayor na kung pwede medyo mapataasan. Anyway, because the legacy said, why not increase the floors because sayang din, no? Anyway, it's a medical institution. So they agreed with the 12 stories. Just like the National Cancer Center, 12-story na rin, 20. 20 sila. Okay, and the PCMC will have 12, I believe. Anyway, sila na mismo nagsabi na why not increase the floors kasi to maximize the space. So then we thought, anong gagawin namin sa 12 na yun? Of course, for future expansion, the NKTI Academy, we will have research there, training. We have several competency development training programs, not only for kidney, but also for other diseases if we will be allowed also. And an academy that we thought na matitrain din namin ang other specialty centers, we offer this also to the Lung Center and the Heart Center for critical care. Pwede kaming magkaroon din ng mga academy like that. So, just a thought, actually just 2 days ago, when I read this paper, sabi ko sayang naman if we have so many buildings and mag-create ka lang ng isang NKTI, kunyari, they were asking for regional, kailangan mo mga 3 to 4 billion. Kaya hindi that practical siya when you have so many renal centers. Of course, we're talking pa ito sa liver center maybe in the LGU, the tertiary hospitals, ganyan, and a national if that's what you want, a national liver center. So I don't know if that would be feasible immediately because of your DBM concerns also on the budget. Itong NKTI lang po, if you want to have something like that, it's 4 billion eh. Not to mention, we're catering not only for kidney, we have also liver cases being referred to us for embolization, right? Oo, lahat pating chemotherapy natin, TACE, they are also at NKTI. Mm-mm. Yeah, it will increase awareness that we have a national liver center indeed. But I know it's just being strategic for me. Or if, of course, it's good that, okay, this building is a liver center building, but if it's in proximity with the facility who has almost everything, no, even for the cancer treatment, so that would be more practical. So it's just we don't have a space anymore in the 5 hectare that we have because we have an MAB coming up already and the outpatient and this legacy, which we will have very soon. It's a thought also for you. We agree with the liver center, of course.
Follow-up question, Dr. Rose. Considering that we've already heard about the statistics with the mortalities with liver concerned cases, can you compare your numbers with the kidney and the liver? Sinong mas maraming nadedelikado lately in cases? Would it be the kidney cases or the liver cases? Because
Okay.
considering that you already have your kidney center, is it because marami rin ang cases natin ng kidney, or maybe because if we put up our national liver center, kasi talaga namang nakikita na natin yung numbers na malaki-laki rin naman talaga. So have you seen the numbers on cases of people needing liver care or cases? Kasi kung alam na nila na meron tayong ilalagay na liver center, kahit before pa siya magiging end stage, diyan na sila magpapahospital. Diyan na sila magpapacheck. Diyan na nila kailangan gawin yung kailangan gawin. Until of course, nagrabihan na yung case nila, kailangan na nila yung transplants. Kailangan na nila yung medyo end stage na help na maibibigay ninyo. Pero sa ngayon nga na, if you claimed that meron na tayong almost everything that you need in the Transplant Institute, maganda po to. Pero yung cases nyo ba, mas mataas din ba kaysa sa liver? I'm just concerned na,
Yes.
bakit hindi tayo pwede magkaroon ng liver center kung gano'n ang kalaki ang pangangailangan?
Actually, I think I get what you mean. Na talaga akong mas maraming renal cases. Renal cases going to end stage. Mas marami talaga. Okay? And it's even more than the liver going into end stage. I also have statistics on that, which I will give to you, no? Yes. I trained also abroad for the liver, Cambridge and then Pittsburgh. And then I said, it will be like 20 years later when we will develop such liver centers maybe, because it's very expensive for the liver transplant. So when I came back, sabi ko, paano ba tayo magli-liver transplant nito? And my predecessors were also hesitant to have this, strengthen this program right away on liver. But we still had the liver transplants, and I think we have more than 40 na since I came back. Why? Because for a liver transplant, it's like spending for 10 kidney transplants. Yun ang sabi namin. It was really expensive. But of course now, we have our liver transplants now are being helped by the our corporate budget also, plus a help from GLs and your malasakit. So there was no GL and malasakit before. So when I came back, nasabi ko, ganun kamahal ang liver transplant. Ha? So it has to be pushed really this mga early detection na ito para hindi na transplant agad. When you have like that, baka resection lamang yan, which is very manageable even in a tertiary hospital, maski hindi na sa NKTI. But when it's really beyond the resection or pag-alis, beyond transplant then because it is very extensive, then what can we do with these patients? So, hindi ganon na sasabihin, ay, konti kasi liver transplant kasi ganito, ganyan. It's because they come very late, these patients. They come very late. Now, it's for this liver center now to catch these patients in the early stage. Mga metabolic mo dyan, doktora, liver cancer later on, hepatitis, prevention of hepatitis in our community. In Taiwan, bata pa lamang lahat or even pagka newborn pa lamang nag-immunize na sila ng against hepatitis. So these are in the prevention side, no, ito ngayon ang tatanggapin ninyo sa inyong liver center. Prevention of all this. Hepatitis is isang reason for the cancer.
Mr. Chair, one more.
All right. After Congressman Roque, then we could recognize the lady.
From
Go
the
ahead.
Go
ahead.
Hepatology.
Oh, one more. Okay.
Mr. Chair, I'm happy that I already heard it from Dr. Rose that you actually acknowledge the need
Yes.
for the center, and I'm because I would say that I really support this bill, and considering that everything else before it becomes critical, everybody will go to you for transplantation, for any other specialized care for the patients. Pero siguro kapag nalaman ng mga tao, meron tayong liver center, dediretso sila doon bago pa umabot sa end stage. So we have that first
Yes.
stage, second stage. It is very important, especially kasi for everybody else that we know, yung may problema sa kidney, may problema sa lungs, may problema sa heart. These are the places and the institutes that they all go to. Hoy, ang Pilipinas merong liver center. It's like a hope for the Filipinos. Aside from pwede silang ma-diagnose in their own tertiary hospitals, in their own districts, everywhere in the Philippines, but there is hope na baka may mga specialized doctors who are also doing their clinics in the liver center. Diba? Mas maganda yan. Di ba nagki-clinic lang naman ng mga doctors natin. But knowing na meron kang mapupuntahan, it's an additional hope for the Filipinos. And I'm sure kung nakagawa nga tayo ng paraan para magkaroon tayo ng cancer center, I'm sure hindi ganun kahirap din para pwede na natin tumalabi. Hindi naman siguro tayo parating hindi ani DBM. Pero kasi, honestly, personally, everybody will eventually need the liver center. Personally, ako, problema ko yan. Kasi for somebody na wala ng gallbladder, problemang malaki yan para sa liver ang stress niya, di ba? Ang toxicity ng katawan mo, dire-diretso na sa liver mo. So, I think hindi lang ako yan, di ba? Maraming tao posibleng magkaroon ng problema. Hindi naman din natin mapipigilan kahit hindi umiinom, hindi alcoholic. Nagkakaproblema rin sa liver. Recently, my mom just passed away a few days ago. And the only one that killed her was her liver. So, ang mahirap talaga, tingnan natin to kahit ano, walang mapupuntahan ng tao eh. Pero I'm glad, Doktora, that you are for it. And we're hoping that we will really have this bill approved and hopefully DBM will eventually look for appropriations and funds there. Thank you, Mr. Chair.
Thank you. With your indulgence, Dr. Conde, I'd like to recognize first Congressman Ferrer. I believe she wishes to respond to Dr. Rose with regards to the insight she has given. Congressman Ferrer.
Mr. Chair, with your indulgence, can I hear first what Dr. Actovite would like to say?
Sure, go ahead. You're recognized.
Okay, good morning, doctors again. So in response with Dr. Liquete, of course, we would like to thank the Congress for having this momentous and a bold move of having liver center. Being a young hepatologist, since I came back from training as well abroad, I really, it's one of my dream also to have our own liver center and to perform liver transplant here in our country. We have a lot of specialists already, hepatobiliary surgeons, transplant hepatologists who are well trained, and we are looking for maybe really an identity or an institution of having a liver center. I think liver center not only serves as being a prevention, a source of prevention, awareness of liver diseases. We have been with DOH together with DOH in movement of the vaccination for, as we know, for hepatitis B. So I think there is already a law for that, that all newborn infants will receive hepatitis B vaccination. But it's not only hepatitis B. There are a lot of other possible liver diseases that can lead to liver cirrhosis or end-stage liver disease. So as we know, also here in our country, most prevalent also is the alcoholic liver disease or alcoholic liver cirrhosis. And of course, I think it's really very timely now that we could have this law to, of course, we envision for our future generation. So we don't want na we wait na kung kailan kailangan saka lang tayo magpuput up ng ganito. So of course we envy kidney transplant. I think we all started from this small, and of course we envision also that liver transplant would pursue also, and to have our own liver transplant center or liver center. Besides alcohol, yun nga, the now silent epidemic in Western countries, Western Pacific, the fatty liver. So it's really timely to be prepared for that. And in cirrhosis or end-stage liver disease, as we all know, or if you know, for end-stage liver disease, the only management is liver transplant. And there are a lot of Filipinos. It's most common morbidity and mortality worldwide, even here in our country. So it's really very important to have our liver transplant. Based on our cases, kasi the most common, for example, I have a lot of patients with cirrhosis, advice for liver transplant. Most common hesitancy of my Filipino patients would always be the budget. In our country, around mga 4 to 6 million yung liver transplant, no? So I hope na ma-achieve din namin sa kidney na kung kayang mapababa ng at least 1.5 million, no, para magawa natin, kasi maraming nangangailangan pong Pilipino ng liver transplant. And even also liver cancer. The problem kasi, yun po, nowadays, majority nakakatch nga naming late na. Kumbaga, there are a lot of therapeutic management that we can offer for patients with liver transplant. We have the liver resection together with our surgeons. We have also our other management, the loco-regional therapy, as mentioned by Dr. Liquete, the transarterial chemoembolization. We have specialists here, the microwave ablation. So we have a lot of doctors who are willing to support or have this liver center and to have this identity na mga liver specialist. And of course, the liver transplant. Maybe if we put up our own liver center, there are a lot of Filipinos would like to have liver transplant here locally instead of going India or going Singapore to have their liver transplanted. Thank you, sir.
Thank you. Before we proceed, we wish to recognize the representative from the 6th District of Bulacan, Congressman Salvador Pleito. Morning. Yes. Congressman Ferrer, I believe you wish to respond.
Thank you, Mr. Chair. I would like to thank the Hepatology Society for their support for the bill. And I believe that our doctors here are all very good. So it's just a matter of providing facilities and of course, it's the cost is also a consideration. It's very expensive. That's why we want to have this liver center so that those who cannot afford will be able to afford. And it's true that people still go to other countries to get treatment. Why not do it here? And in fact, Congresswoman Larnie Rocky also mentioned that maybe later on people will be coming to the Philippines to get the transplant. People from other countries will be coming here because we have this liver center. We have specialized center just for liver, and our doctors are all very good. So, we're looking at the future. And with regards to the budget, that's why Congress has the power of the purse. So if Congress legislates this bill into law, then we will provide for the budget for this. That's why this is like a starting point. We are starting with this bill, and hopefully, eventually, it will become into law. And of course, appropriations will be provided for. And after hearing, Mr. Chair, all the resource persons, the more that I realized that the more that we need a liver center, and we're very fortunate that Dr. Liquet is she's very good at what she does. I only met you now, but I can see that you know what you're doing, and we will learn from your expertise. Whatever you learned overseas, you will apply it here, and we're happy that you came back and you're here with us and with the government, DOH and KTI, so that your expertise will be a really big help with regards to establishing this liver center. And yes, they should have their own identity. Iba po kasi yung meron talaga silang institution eh. And it will also create awareness to the public na yung liver problem is a serious problem. And I also would, before I end, Mr. Chair, I would like to express my condolences to Congresswoman Roque. I did not know that her mother just passed away a few days ago, and even if she has a death in the family, she's still here with us. So I think I will end with that, Mr. Chair. Thank you very much.
Thank you. Yes, the committee also in this representation extends our condolences to Congressman Roque. Your mother will be in our prayers, and we hope that wherever she is, she could see that we are doing this actually in her honor. I wish to clarify a few things with the author that I believe that in the proposed bill that this is supposed to be a GOCC, but would the structure of it being under the DOH also be amenable, or what is your
Yes,
what is the pleasure?
Mr. Chair, as I mentioned earlier, I am amenable to amend or revise that provision. That's not a problem.
Thank you, Congressman. So just hearing all of these, and I'm trying to reconcile all of the insights that we have here. Because we are looking at legislation as something as it's strategic in nature. That having it here will ensure that there is the appropriate resources and manpower, as well as proper guidelines. We were looking at the recently passed regional specialty center bill law. It's a law already, and okay. So both the DOH and GOCC specialty hospitals. Based on this, if it is correct, the DOH could actually establish their own specialty centers for liver already. Having said that, though, institutionalizing it through a law ensures that there is the appropriate funding also for it. I believe also that with that, there is also upwards pressure coming from Congress for all of the other institutions. I wish PhilHealth was also here so that they could include it already in their comprehensive universal health care package to include it as early screening that could be serviced by any specialty regional specialty hospital, so that they don't have to go through central, where normally it is already end stage. yeah, we are in the opinion that early screening and having the appropriate government funding also to either subsidize or to pay for the needs of our citizens is paramount to ensuring the success of this legislation. So, any other insights? Yes, Dr. Rosette.
Yes, I would like to mention that actually DOH is on this because of that bill. Although hindi nga included before ang liver center, right? But we have already this TWG, so we can have this framework also, just like what we have done. Now, just a food for thought also. You have the National Cancer Center, right? Now, I'm sure if a patient would have liver cancer, they will also go to the National Cancer Center. So, I think there's a need na lang talaga for a collaboration among the centers. Kasi, para maging strategic siya and of course effective, ang logistics natin is not, kalat-kalat, this and there. So, there will also be a time when your patients in the liver center that you will also go to the National Cancer Center. There's a National Cancer Center. May liver cancer din doon. It's not just maybe for the chemotherapy that they will go there, but also for other special care for cancers. So just food for thought also that we need collaboration on this. Now, if there is a lead organ transplant center,
Then NKT.
then I need a transplant already, then maybe all these are all, they have the facilities, we have the fellows who have also trained, we are a training program for fellows who can handle transplant patients, and also our immunosuppression. So, kailangan lang talaga is collaboration. So, we can serve the resources of the kaban ng bayan.
Mr. Chair,
Thank you, Dr. Rose. Yes,
I don't
Congressman
think there's
Ferrer.
anything wrong with having a liver center if there's already a cancer center. They can go to either. There'll be they will have different venues or places they can go to, and there's nothing wrong with that.
I actually agree with Congressman Fair that because I mean it's the study of our human anatomy is still very complex. There's so many things that we still do not know, and liver cancer is just one aspect of liver disease. So having the liver center actually here could also provide another avenue depending on the conditions of the patient, uh, where we could already establish either both escalation and collaboration depending on the patient's case. Dr. Conde, yes, you wish to respond.
Yes, ma'am. So I think the vision for the liver center is not, yeah, I would agree that it's not merely for liver cancer, but also, for example, our end-stage liver disease, ma'am, liver cirrhosis. There are a lot of patients with liver cirrhosis who suffer complications such as varices, who needs urgent endoscopy, ascites or HRS, hepatorenal syndrome, who also needs liver dialysis. So, yeah, I would agree that it's not only liver cancer, but also dealing also with other liver diseases, and most especially liver cirrhosis. Yes, ma'am. Thank you po.
Thank you. One
Yeah.
last.
One last. Yeah, I agree. It's not cancer. Kaya lang na-divert tayo about cancers. Now, when it is still transplantable, then we do transplant for liver cancer. But at talagang the variety of liver diseases will mainly go to the liver center, I'm sure. Thank you.
Thank you.
Mr. Chair.
Then all the more. Yes. Yes.
Tapusin na natin.
Yes.
Mr. Chair.
Thank you.
After listening to all the resource persons and the comments that we received, I move that we approve this House Bill numbered 123 and 6324, subject to style and amendments, Mr. Chair, and for the committee secretary to prepare all its files for the committee report. I so move, Mr. Chair.
There's a pending motion. Anybody second? Okay. So there's a pending motion and duly seconded. Chair rules that the House bills numbers 123 and 6324 is hereby approved.
Mr. Chairman,
Yes,
may I request that all members present here should be made as co-author?
Second, Mr. Chair.
thank you. So there is a motion and duly seconded upon the permission of the authors. All members present here are made co-authors of this bill.
Mr. Chair, it's an honor.
Thank you. Thank you very much. Congratulations. And to the DOH, thank you very much for your insights to Philippine Hepatology Society. I believe that with this, this is just an initial deliberation, and having made aware of this legislation could also bring to light to DOH to actually anticipate it already in their discussion for including it in their regional specialty centers IRR, so that while this law is being passed, it could already be implemented into the regional specialty centers. Thank you very much. Right, thank you. We move on. So next item in our agenda is the consideration of House Bill 4793, an act modernizing the Philippine Orthopedic Center, upgrading its service facilities and appropriating funds therefor, by Representative Gus Tambunting. But in
Mr. Chair,
yes, Congressman Roque.
on behalf of Representative Gus Tambunting, may I move that explanatory note of House Bill number 4793 be considered as his sponsorship message. Mr. Chair, I so move.
Thank you, Congressman Roque. Let's go through our resource persons once again to get their insights on the proposed measure. Could we call on Ms. Phoebe Kabab? Ms. Kabab? Oh, okay. Mr. Glenn Cruz, you're recognized.
Thank you, Mr. Chair. I would like to read, for purposes of brevity, I will cite the salient portions of the draft position paper from the Department of Health with regard to the House Bill number 4793, an act modernizing the Philippine Orthopedic Center, upgrading its service facilities and appropriating funds therefor. We will submit to the committee secretariat the final copy of the position paper as soon as it is signed by our Secretary Ted Herbosa. In brevity, we would like to say that the DOH supports the proposed measure, and it is committed in modernizing the POC, or the Philippine Orthopedic Center, so by providing the funding for the infrastructure, human resources, and equipment in alignment with the goals of the Philippine Health Facility Development Plan, as well as the strengthening of the healthcare provider networks as mandated by the Universal Healthcare. And so we shall be submitting our position paper. Thank you, Mr. Chair.
Thank you, Mr. Glenn Cruz. We now recognize Dr. Jose Britanio Pujalte, Jr., Medical Center Chief 2 of the Philippine Orthopedic Center. Sir, you're recognized.
Thank you, Mr. Chair, and other esteemed members of the Committee on Health. We acknowledge House Bill 4793 and support this bill sponsored by Congressman Gus Tambunting. But we would like to mention that the Philippine Orthopedic Center has been modernizing since 2018, and therefore the infusion of funds will be needed and most welcome. We have the Philippine Orthopedic Center is the National Specialty Center for Orthopedics and Rehabilitation Medicine. So we are constructing two buildings. The Ortho Apex building was started in 2018. I'll just show you some pictures. And the rehab center was started last year. Next slide, please. So would like to thank the committee for this rare spotlight on the Philippine Orthopedic Center. Next, please. So unlike liver diseases, we cover the whole spectrum of orthopedic or musculoskeletal cases, from bone cancer to your everyday road traffic accidents or crashes. Next, please. So I'd like to point out that in 2023, we had 4,009 surgeries, but as of today, we still have a backlog of 630 surgeries. Next. And this is just the memo that we are the National Specialty Center in both orthopedics and rehab medicine. Next, please. This was from our national staff meeting to show that the Philippine Orthopedic Center is the apex hospital. In that algorithm, you will see that we are the endpoint for road crashes and bone cancer, osteoporosis and osteoarthritis, and other cases in orthopedics. Next, please. We have been serving continuously, and I'd like to point out to the committee that our private patients is not even 1%. With the 99% of our patients are indigents. So we depend on the MAIP, the Indigency Fund, PhilHealth, and the Malasakit Center for assistance. Next, please. Next, please. So this is just to highlight that our phase 3 for our orthopedics apex building still needs an infusion of about 252 million to finish it. The first 3 floors are now operational. Next, please. And we would like to inform the committee that our rehab apex building had its MICA approved until 2026. This was approved by DOH and DBM. Next, please. Some pictures. Next. Very busy. We receive 550 patients a day for our outpatient. Next, please. This is some of our acquired high-tech equipment. With minimally invasive spine equipment, we can do day surgery. The patient comes with the disc in the morning. We do our surgery and they go home in the afternoon or early evening. Next, please. This is what happens. I don't know if our members saw that viral clip of that motorcycle going cross-flowing in the Skyway. If he was alive, he would have something like this. This is an external fixator. If that patient would be alive, he would have head injury, abdominal injury, and multiple fractures of long bones. No? So, an orthopedic case. Next, please. This is our rehab and orthopedic apex. Next, please. This is our ortho apex, already functional. Next, please. And this is our last slide, please. Our rehab apex, which went into construction late last year. Thank you very much.
Thank you, Dr. Pujalte. I do have a few questions. In the 550 cases per day that you service in your outpatient center, how many of those are outside of Metro Manila?
Most are Metro Manila, about 70%, but our catchment area includes Bulacan, Cavite, and Rizal.
I was also made aware of what they call this Bukas project. Could you give us more information or insights on what this project entails?
This is a new initiative of our Secretary of Health, Secretary Verzosa, but this is ambulance surgery was set up in connection with the local health hospitals, LGU hospitals, and they can still refer to the Apex hospitals, but with the construction, with the initiative of Bukas centers, it's like being able to have surgery at the local level without going to the Apex hospital.
So it's mostly capacity building, basically, so that you could be able to address some of these concerns, at least on a local level, before it escalates into your Apex hospital. I believe, again, either early detection or early attention to a certain medical case is the best way for us to either mitigate or even reverse the current conditions that the patient has. Is this correct?
That is correct, Mr. Chair. It's also that our Apex hospital receives complex cases that cannot be managed at lower levels of care.
So parang sinasala nyo kaagad dun pa lang sa local level. If there are some cases that could already be addressed there, you do not have to overburden our Apex hospitals with some of these cases that are supposedly simple in nature, at least ma-address na already on a local level.
That is true, Mr. Chair. The other problem is that the orthopedic cases are intensive, nilalagyan po ng bakal, and that is the reason why some of them end up in the Apex hospital.
What is the status of these, the Bukas project so far?
I believe the first center was already inaugurated a few weeks back in Pampanga.
That's the first center. How many do you envision this to be established in nationwide? Yes, Ms.
Can we recognize the
Ms. Cabab,
health
yes, you're
facility,
recognized.
Good morning again, sir, Mr. Chair. We would like to just provide additional inputs about the bagong urgent care centers or bukas. This is actually, sir, a primary care facility that is envisioned to be or establishing to be an outpatient extension of DOH hospitals, which shall be managed and operated by DOH hospital. So the DOH hospital will be providing the human resource and specialists as needed. It will be run as an outpatient center in selected or prioritized places. We are planning to have 28 Bukas centers, which will be strategically positioned, and one we are planning to have it in state universities with medical schools, and also for those super health centers that are not being utilized because of the lack of HR or human resource. So we will be augmenting the rural health centers or the LGU-run primary care facilities. They shall offer specialty services with the help of our specialists from the OH hospitals. Thank you, sir.
Thank you, Ms. Cabab. Other resource persons, Mr. Moreno from DBM.
Magandang umaga po ulit, Mr. Chair. Sa panukalang batas po para sa modernization po ng Philippine Orthopedic Center, definitely po the DBM support the bill. Meron lang po kaming dalawang concern. Una ay sa Section 5 po ng nasabing panukalang batas sa POC Rehabilitation and Modernization Council. We would like to suggest po to stipulate in the bill that the provision of the administrative, operational, and technical services to the members of the council shall be handled by the personnel concerned of the organic offices units of the DOH and or the Philippine Orthopedic Center. That's number one po. Number two po, katulad po na nabanggit kanina, we discourage po the earmarking of funds. Minumungkahi po namin na dumaan ito sa process, sa budget process po. Pero at the end of the day, it is the discretion of the Congress, so we defer to the wisdom of this committee on the matter. That's all, Mr. Chair.
Thank you, Mr. Moreno. Any other resource persons that wish to provide any insights on the proposed measure? If there's no more, then we open the floor to our members who wish to seek clarification and interpolation. Okay, here, if there, yes, Doctor. If there are none, can I hear a motion?
Mr. Chair, there being no other resource persons or members of the committee who would like to give their comments on the bill, may I move for the approval of House Bill number 4793, subject to style and amendments. I so move, Mr. Chair.
I second the motion, Mr. Chair.
There's a motion to approve House Bill number 4793, and it's duly seconded. House Bill number 4793 is hereby approved. Thank you. Before we proceed, also, we wish to recognize the representative from the Lone District of Apayao, Congressman Eleanor Bulut Begtang. Good morning. Thank you. So moving on, we are here to tackle now House Bill number 5858, entitled An Act Providing for Modernization Funding for the Philippine Heart Center, Increasing and Reorganizing its Administration, to provide a comprehensive cardiovascular care enhanced by education and research that is accessible to all and for other purposes, authored by Congressman Michael Romero, sponsored on his behalf by Congressman Roque.
Mr. Chair, on behalf of Representative Michael Romero, I would like for House Bill number 5858, may I move that is explanatory note be considered as his sponsorship message. I so move, Mr. Chair.
Thank you, Congressman Roque. With that, let's hear from our resource persons. We begin again with Ms. Cabab from DOH Health Facility Development Bureau. Ms. Cabab.
Good morning again, Mr. Chair, and to all. Okay. The DOH supports this bill, and may I read? For a while, sir. The DOH lauds the noble intent of the aforementioned House Bill. This seeks to provide modernization funding to the Philippine Heart Center to uphold the highest standards of cardiovascular care. This is a self-reliant institution to the health needs of the Filipino people. In relation to this, the proposed measure of the DOH is its Health Facility Development Bureau has crafted this PHFDP and the resource stratified frameworks which defines the services and essential resource requirements necessary at each level of care. This is from primary care up to the national specialty centers. The Philippine Heart Center is designated as the National Specialty Center for Cardiovascular Care and shall have the service capability of managing all cardiovascular care cases. This includes serving as the national and referral hospital, a policy-making body, and a protocol development body. The PAC shall have the highest level of clinical service, as well as the capacity for training and research, including clinical practice guidelines and development. Thus, The DOH supports the proposed measure and is committed to modernizing PHC by providing funds for infrastructure, human resources, and equipment in alignment with the goals of the PHFDP for specialty centers, and to strengthen our healthcare provider networks for an improved accessibility of all health facilities. Thank you.
Thank you, Ms. Cabab. So next, as a resource person, I believe Director Josephine Guillermo Lopez of the Hospital Support Services is here.
Good morning, Mr.
Doctor,
Chair and
yes.
Your Honors. Good morning po. In behalf of the Philippine Heart Center, we would like to thank the Honorable Michael Romero for sponsoring the Bill 5858, extending additional funds for the modernization of the Philippine Heart Center. In the next 5 years, Your Honor, we envision the Philippine Heart Center to be expanded by a 12-story building. And this bill will definitely help the Philippine Heart Center for our modernization plan. Thank you. We prepared a slide, Your Honor, to show our proposed building. Next, sige po, sige pa po. This is the list of our equipments and our infrastructures that we will be needing for our expansion. Sige pa po. Sige po. The total, however, the total funding we need will be around 2.5, Mr. Chair, to complete the 12-story building as well as the equipments needed. And this is our site development of the 2.7 hectares that we have. Sige po. Yan ang last. That's the floor plan, Mr. Chair, of the 12-story building. Thank you.
Thank you, Dr. Guillermo. Anything? Did they wish to add anything more into your presentation, or is this? Yes, ma'am. Please state your name for us to recognize.
Good morning, Your Honor, Mr. Chair. I am Dr. Maria Teresa Abola, Deputy Executive Director for Education, Training, and Research Services of our esteemed institution. We thank profusely Representative Romero for sponsoring this bill that will not only support further construction of our dream 12-story building, but also to enhance funding, augment funding for continuing research projects, education, and training that will all redound to the discovery of new methods of treatment to improve on the cardiovascular health outcomes of our people. We surveys around 14,000 patients per year. Cardiovascular disease, specifically ischemic heart disease, is responsible for the leading cause of death in our nation and even all around the world, about 114,000 deaths per year, closely followed by cancer, about 60,000 per year. So this really underscores the importance of continually supporting the upgrade of our facilities so that we may be able to extend services to all our colleagues, to our patients. We also would like to take pride in sharing that the Heart Center has led the development of 17 regional heart centers for our 17 regions. And so far, we have 5 fully fledged regional heart centers in Bicol, Iloilo, Cebu, Davao, Cagayan de Oro. And the rest of our regions have facilities that are waiting to be accredited, prepared for the provision of cardiovascular care, education, and research and training. So we thank our sponsor and, of course, the committee for hearing us out on this important contribution to healthcare. Thank you.
Thank you. Just a point of clarification before we recognize the DBM. Are you structured under the DOH or are you structured as a GOCC currently right now?
We are a GOCC specialized hospital, Mr. Chair.
And I believe as a GOCC, you do have your own means of budgets, but you
Yeah.
also receive subsidy also from the GA. Is this correct?
Yes, we receive subsidy, Mr. Chair.
Okay, thank you. For that, so again, we'd like to recognize from the DBM, Mr. Moreno, your thoughts.
Magandang tanghali na po sa lahat. At tama po, Mr. Chair, na ang Philippine Heart Center is given subsidy by the national government para po sa FY 2024 meron po silang 2.4 billion na ibinigay para po sa implementasyon po ng kanilang mga programs, and also they are also authorized to use those prior years, no. Kagaya po ng mga naunang bill na tinalakay, the DBM po supports all the initiatives that promote healthcare. Pero ipagpaumanhin po uli na consistent po sa position po ng economic team, we just only discourage po the earmarking. We support the bill, but earmarking of funds ay yun lang po yung amin discourage. We just want that all the proposals and appropriations should done in the budgetary process. That's all, sir. Thank you.
Thank you, Mr. Moreno. Having heard all of our resource persons, we wish to open the floor to our House members who wish to interpolate or ask any questions or clarifications. No. Hearing none. If there are no other members that wish to provide any insights, questions, or clarifications, do I hear any motion?
Mr. Chair,
Yes.
I move that we approve House Bill number 5858, subject to style and amendments, and approve the same. And let me also move that the committee secretary prepare its files for its committee reports. Mr. Chair, I so move.
Okay, there is a pending motion to approve House Bill 5858. Duly seconded. House Bill 5858 is hereby approved. Congratulations.
Mr. Chairman,
Yes, Mr. Congressman Garcia.
may I also move that we will be included as co-author in these both two bills, 5858 and 4793. Thank you, Mr. Chair.
Second, Mr. Chair.
Okay, there is a motion duly seconded, making all members present co-authors for House Bill 5858 and 4793. Duly seconded. Motion's approved. Thank you. Okay. So next on our agenda is the deliberation on local bills. I want to. There are three House bills here that with one principal author, House Bill 1358, entitled An Act Upgrading the Iranon District Hospital into a Secondary Level Hospital and Increasing the Bed Capacity for General Care Services from 70 to 200 and appropriating funds therefor and for other purposes. House Bill number 1359, entitled An Act Upgrading the Datu Blati Sinsuat District Hospital into a Secondary Level Hospital and Increasing the Bed Capacity for General Care Services from 100 to 200 and appropriating funds therefor. And House Bill number 1369, an act upgrading the Dato Odin Sinsuat District Hospital into a secondary level hospital and increasing the bed capacity for general care services from 50 to 200 and appropriating funds therefor. All of these bills authored by Congressman Bai Dimple Mastura. I believe Congressman Roque is to sponsor this measure on her behalf.
Mr. Chair, on behalf of Representative City Bai Dimple Mastura, may I move that her explanatory note for House Bill numbers 1358, 1359, 1369 be considered as her sponsorship message, considering that all three House bills that are being proposed are all for the upgrading of hospitals that are located in the Iranon district, Datublad, Sinsuat district, and Sinsuat district hospital. May I move also, Mr. Chair, that her explanatory note be her sponsorship message, Mr. Chair.
Thank you, Congressman Roque. And then, so we'll go through these. We'll get the position of Mr. Glenn Cruz from DOH.
Thank you, Mr. Chair. For clarification, we'll be reading the position paper that is drafted to be signed by the Secretary of Health on behalf of the Department of Health. Similarly, I would like to facilitate our hearing and as well as to facilitate the reading of the position papers. I would just like to state that similarly, all of the three bills authored by our honorable representative Siti Shahara Matsura, that the position of the DOH as proposed shall be to pose no objection to the proposed increases for as long as it remains under the direct supervision and administrative control of the provincial government of Maguindanao del Norte. Please be assured that notwithstanding this ownership, the DOH shall provide the continuous technical assistance and monitor the compliance to the standards in accordance to the Philippine Health Facility Development Plan. And we shall be sending these position papers to the committee secretariat once signed by our Secretary of Health. Thank you, Mr. Chair.
Thank you, Mr. Cruz. I believe the Chief of Hospital of Iranon District Hospital, all the way from Maguindanao, is here, Dr. Harris Macapegas. You're recognized, sir.
Good morning, Mr. Chair, and other members of the committee. First of all, I would like to give you the short background of Iranon District Hospital. In fullness of time, burgeoning of community and places in set in motion, together with this progress, the need for medical consciousness and upgrade services of the people also arises. By these needs and demand in health services and through the efforts and the goal of the government to serve its people, particularly in healthcare services, the construction of new hospital located at the heart of municipality of Parang, Maguindanao, which is Maguindanao del Norte. The Parang Iranon District Hospital first inaugurated on November 2001 by the late Congressman Didagan Diggs de Langalen. The community rejoiced and glad that a new hospital was built to serve the people. In due course years of services in community, the hospital has eventually closed on the year 2004 due to lack of funding. As the years go by the people under the Iranon municipalities, namely Parang, Buldon, Matanog, Barira, Sultan Mastura, Sultan Kudarat, and other nearby municipalities and provinces are longing and wishing to re-establish the hospital to address the health concerns of the people. On the year 2006, the Autonomous Region in Muslim Mindanao crafted a bill to create a hospital, the Muslim Mindanao Autonomy Act number 196, an act creating and establishing the Iranon District Hospital in the municipality of Parang, Maguindanao, appropriating funds therefor and for the purposes. On the Section 2 of MMA 196, the hospital shall have a minimum bed capacity of 70. This act passed by the Regional Assembly on July 2006 and approved and signed by the former Regional Governor Datu Saldi Puti Oy Ampatuan on July 13, 2006. After years of waiting, the rehabilitation of former Parang Iranon District Hospital formerly began. The rehabilitation of the hospital is led by the Department of Health, ARM, through the local government of Parang, who is in charge of the rehabilitation of the said hospital. On May 12, 2020, after 20 years of hiatus from service the provincial government of Maguindanao reopened the Parang Iranon District Hospital as temporary treatment and monitoring facility, serving the people who are infected with COVID-19 virus with mild to moderate symptoms. In succeeding years, the Parang Iranon District Hospital began in preparing its manpower and services to accept patients. While the hospital is on the process of preparation, the hospital helped the Department of Health and Ministry of Health to its campaign to end the COVID-19 pandemic. The hospital served as one of the vaccination centers for COVID-19 in the province of Maguindanao. March 3, 2022, a memorable and remarkable event for the Bangsamoro people, most especially in the Iranon municipalities. The Bangsamoro government officially launched the Iranon District Hospital, formerly Parang Iranon District Hospital, in the municipality of Parang, Maguindanao del Norte. The Iranon District Hospital starts as infirmary hospital, which could care and treat mild to moderate illnesses, minor operations, and admit patients, and serve as the catchment area for the town of Parang, Matanog, Buldun, Barira, Sultan Mastura, and some parts of Sultan Kudarat in Maguindanao, and even the towns of area of Balabagan and Kapatagan, Lanao del Sur, and also in North Cotabato. Iranon District Hospital is a government-managed and owned hospital under the Ministry of Health, BARM. It is single-story hospital with 25-bed capacity as authorized beds set by the license to operate. But the implementing bed is 50, catering the healthcare needs of the people in Iranon area with an estimated total catchment population of 364,000. That's all, Your Honor.
Thank you. Next up, we'd like to hear from the Chief Administrative Officer and the officer in charge of the Datubla Sinsuat District Hospital, Ms. Noraya Mustafa. You're now recognized.
Mr. Chair, to the members of the committee, all present here, Assalamualaikum warahmatullahi ta'ala wabarakatuh. Good morning. By the way, in behalf of our OICG Pop Hospital, we will representing the hospital. I am Dr. Almadin G.D. Maukum, currently the Chief of Clinic of the hospital. So, the Datublat, since what this that district hospital is currently a level 2, 100-bed capacity by virtue of the Bangsamoro Act number 25 as approved last July 12, 2022. But currently, we are operating as level 1, 100-bed capacity. It has a total number of 154 employees, 76 of which are permanent. 78 are contract of service. So the hospital is located at Noro Upi, Northern Maguindanao, Barm region. Nestled amidst mountains, sprawling plains, valleys, and plateaus, the hospital is serving over 139,778 residents, particularly indigenous people of North Upi, South Upi, Datubla, Sinsuat Municipality, and other nearby areas. Our hospital has become a vital catchment facility for hard-to-reach community with challenging terrains. So to give you the data, for the past 3 years in terms of our bed occupancy rate, which I believe importante po ito in dealing with this kind of upgrading. In 2021, our bed occupancy rate is 89%. In 2022, with 126%, and in 2023, we have 176% bed occupancy rate. It can be noticed that there is a continuous increase in our bed occupancy rate alongside with an increasing number of both infectious and non-communicable diseases, and to highlight those patients undergoing dialysis. So from this data, the hospital is challenged to meet the required health services that our constituent needed. Many instances, there are those patients requiring tertiary level of care being admitted in our hospital but due to the limited service capacity, they need to be transferred at Cotabato Regional and Medical Center, the only tertiary hospital nearest us in northern Maguindanao. But the patient family opted to stay due to financial concerns, and eventually, sometimes these patients end up dying. So with our mission to provide efficient, optimum, and equitable health services with integrity to the people, anchors to the implementation of the Universal Healthcare Law, specifically on its provisions or agenda on primary care provider network, and also to the 12-point agenda of the Bangsamoro Autonomous Region in Muslim Mindanao, and the 8-point agenda of the Department of Health. It can only be attained if there is a continuous development of the facility in all its aspects. So the proposed upgrading into a 200-bed capacity, courtesy of this House Bill number 1359 by our very own honorable representative, Bai Dimple Mastura, can somehow help in the realization of this mission in its utmost need. Thank you very much.
Thank you, Dr. Democom. Up next, we'd like to hear from the representative of Dato Odin Sinsuat District Hospital. Is Dr. Bai Divya Eileen Samama here? Doctor, you're recognized.
Yes po, good morning, Mr. Chair, and to the members of the committee and everyone here. Dato Odin Sinsuat District Hospital was formerly known as the Naig Municipal Hospital. Its creation was made possible by RA 6918, an act establishing a Level 1 10-bed municipal hospital in the year 1990. In 1992, the hospital started its operation. Despite its limitation, DMH then was able to exceed the intended operation, especially in the year 2017, where bed occupancy rate reached as high as 400 to 500%, justifying the need for our upgrade. 30 years after, in the year 2019, RA 11330 was materialized, converting the Naig Municipal Hospital to a 50-bed capacity district hospital, retaining our Level 1 status. As an overview of our area of responsibility, the undivided Maguindanao province in BARM is subdivided into 6 health clusters. The third cluster is composed of 6 municipalities, namely Kabuntalan, Dato Udin Sinsuat, Dato Angal Midtimbang, Talitay, and Talayan and Gindulungan, and has a total clustered population of 233,331 based on 2020 population census. Almost half of this population is located in Dato Udin Sinsuat Municipality, where DOS-DH is located. DOS-DH is the only government hospital in this cluster apart from Camp Shongko, which is exclusively for the armed personnel. All RHUs under the Cluster 3 refer their patients to DOS-DH either for emergency, obstetric care, outpatient and inpatient care, or for diagnostic workshop. The closest government hospital are Maguindanao Provincial Hospital and Cotabato Regional Medical Center, approximately 25 kilometers away from DOS-DH. The said hospitals are Level 2 and Level 3 respectively, and these are the same government hospitals where we refer our complicated cases and when patients need more advanced level of care. With regards to our level of operation, there is an ongoing proposed bill, proposed BTA Bill number 277, supporting our long-sought budgetary and manpower complement to operate fully as a 50-bed district hospital. A few days ago, we are surprised yet deeply grateful for the initiative of Honorable Congresswoman Bai Dimple Mastura for recognizing the healthcare need of the community we are serving through Bill 1369. If we base this ideal target in population with our population census as an indicator to reach our target of 23,814 OPD patients and 8,819 inpatients, we are far from reaching our desired number of patients to cater. Inshallah, when this bill will be materialized, this will fill in the gaps the healthcare gaps in our community, unloading also the burden from CRMC, and their beds will be allotted to patients in need of advanced care. Although we have only concern sa pertaining to the bill, we have only concerns with regards to the section number 7, yung sa fund support po, because the same section is yung naging problema po namin sa implementing nung aming 50-bed capacity. So parang kailangan pa po namin mag-undergo ulit sa bill, BTA bill, na ongoing na rin naman po ngayon, to fully enact the 50-bed capacity na grant na po sana nung Republic Act. That's all po. Thank you.
Thank you, Dr. Samama. I wish to clarify also with the Datubla Sinsuat District Hospital and in, where's this? The Iranon District Hospital. If there is also a bill under BARM po for your needs, or is this the only bill also filed?
Your Honor, there's a BTA bill now. I think it's in the second reading already.
Okay. So the Iranon District Hospital already on second reading. The Datu Sinsuat ba yan?
Hello.
Yeah, Datu Bla Sinsuat. Is there a BTA bill then? I wish to clarify this.
On the part of the Datubla District Hospital, there was already approved BTA bill, the Bangsamoro Act number 25 po, approved last July 12. So currently, we are a level 2 hospital with 100 bed capacity. Pero po Mr. Chair, ang ongoing operation po namin is level 1, 100 bed capacity. We are still waiting for budgetary allocations for the improvement so that we can improve our hospital to meet the requirement of the level 2 100 bed capacity.
Thank you. So for all the local bills, there is also a BTA bill, and in your case, it was already enacted.
Enacted, already enacted po.
Enacted. So awaiting budgetary
Yes po,
appropriations na lang po.
on the personal services, dina-download na po nila sa amin, and in fact, yung sa health, sa manpower complement niya, meron na pong initial na release po sa amin, and we are just waiting for because for this particular BTA bill, ang agreement po nito or ang proseso po ata nila is by pacing po ang kanilang by pace po ang kanilang pag-release, phase 1, phase 2 and phase 3. So we have already received the phase 1, and we are still waiting for the phase 2 and phase 3. For both the MOOE personal share and the sa manpower complement.
All right, thank you. I'd like to ask the DOH also on your thoughts on the matter with regards to this, given that there is also a BTA bill, and in one case there is one already that has been enacted. I'd like to get your thoughts on the matter regarding this.
Yes, thank you, Mr. Chair. With regard to the BTA measures having been passed, of course, it will be considered and coordinated with our counterpart regional offices as to the assistance. But of course, we have to defer primarily for the investment of the of BARM to oversee and to actually support their own healthcare network, healthcare provider network po nila. Pero of course, the regional offices, particularly surrounding BARM, which is Soxargen, Northern Mindanao, and Zamboanga Centers for Health Development, will have to find out the levels of technical assistance and other assistance that may be needed especially for the operations. So mauna po yung allocation as authorized by the BARM. And then we work with the Ministry of Health of the Autonomous Region to improve further or to increase further kung ano yung kailangan ng kanilang healthcare providers.
All right. Thank you. Okay. Any other resource persons that wish to provide any thoughts on the matter? If not, we'll open the floor to any of our House members that wish to interpolate or seek questions or any comments.
Mr.
Congressman
Chair,
Roque.
Clarification lang po, Mr. Chair, from the DOH. Mr. Glenn Cruz, ang capacity kasi ng tatlong House bills ang in question. They wanted to upgrade their hospitals by adding number of capacity. Yung isa from 70 to 200, yung isa from 100 to 200, and the other one is 50 to 200. Pero in consideration of all of these capacities, bago sila technically consider as level 2 hospital, meron pa silang other requirements. Hindi ba pwede silang mag-add lang ng bed capacity without the rest of the other? Kasi medyo mabigat yung mga pangangailangan ng level 2 na requirements, di ba po ba, Mr. Cruz? Mr. Chair?
Mr. Chair, yes. Yes, thank you very much, Mr. Chair, for our honorable representative. Ma'am, yes, we recognize that in terms of ensuring that regulated properly and licensed properly yung mga hospitals, the consideration is not only the increase of bed capacity or for inpatient care, but also the amount of services and medical expertise that will be exercised as part of the services. So, organizationally importante po sa pag-akyat sa level 2 ang magkaroon ng mga specialists at ma-departmentalize ang medical service, including additional ancillary services na necessary para makuha nila yung kanilang licensing level. No? So regulatory naman po yun. Allocation-wise in terms of expansion, okay lang naman po na makuha nila yung kanilang investment requirements, pero eventually they will the management as well as the administrative control of the hospitals would have to deal on increasing the health workforce, especially the medical expertise, to ensure na within the scope of the investment yung magiging level of service nila. So okay lang naman po na mag-increase ang investment, pero importante rin po yung operational issues as well as staffing issues and training issues ng kanilang, especially yung kanilang medical service po.
Mr. Chair, follow up lang.
Go ahead.
Kasi we could imagine that Maguindanao right now is already 1.6 million in population. And we're only looking at hundreds of additional beds to include other patients na medyo may problema nga naman sa upgrading dahil hindi pa nila kaya yung other requirements for a level 2 hospital. Hindi ba possible na ang DOH tanggalin na nila yung bed capacity as a requirement for them to upgrade lang? Parang, kasi population-wise, marami na tayo Millions and millions na tayo. Maraming problemang hospital na bed capacity lang ang problema. You could see patients outside the doors, outside the buildings na mismo. So I'm like wondering if DOH would be able to consider kung bed capacity lang for now. Kasi yung problema ng mga narinig natin sa mga resource persons, ng mga chief of hospitals, na hindi pa nila kaya yung ibang requirements. Pero kailangan na nila yung bed capacity. So how do we solve this one, Mr. Chair?
All right, thank you. DOH, your thoughts on the matter?
Yes, thank you, Mr. Chair. The technical requirements or the specific requirements for licensure and ensuring the regulations of our healthcare services is written in law, an existing law called the Hospital Licensure Act. So yung capacity po is embedded into the Licensure Act. The DOH has in fact already included the updating of the Hospital Licensure Act as one of its executive legislative agenda, and it is in fact being considered already, and through our legislative liaison is being discussed with possible champions. So nandun po yung it's embedded in the existing law of the Hospital Licensure Act. Kaya po ganun yung measurement natin of providing regulation and licensing to our healthcare facilities.
One more, Mr. Chair.
Yes, go ahead.
Salamat po, Mr. Glenn. Pero I'd like to make a clarification. Nakita ko kasi dito that all 3 hospitals are all district hospitals. So yung provisions niyan, di ba dapat sa DOH? Bakit kanina narinig natin si DBM na it should be again given to the direct supervision of the province? Paano nangyari yun? Na all 3 hospitals are now considered district hospitals. Tapos ngayon yung funding, di ba dapat galing din sa national?
Okay. Yeah, Congressman Roque, I guess we do need to clarify, but I believe for DBM, we are only looking at the national hospitals. Is this correct? The local hospitals will still be under the administration of the province, including the MOOE. Yes, the district hospitals. I believe this will be under them. Not. I believe for this one, the district hospitals, it's normally under the province. Yes. So at least with their budget and their administration, they'll be able to effectively operate these hospitals quicker. Yes. Could I get your insights on the matter? Okay. Although I believe Congressman Roque, the MOOE is with the district. The capital outlay could be still under the national. Yes, under DOH. So as part of, I think, your HFEP? Yes. So pwede niyo namigyan, ha? You heard her. Okay. Yes, Doctor, yeah, from DOS-DH? Yes,
From that Odin Sinswat District Hospital. Clarify ko lang po, Mr. Chair, na under po kasi sa Maguindanao is our fund source is coming from the region, hindi po coming from the province. So kaya po medyo nagkakaroon po kami ng problema with regards to implementation, budgetary complement, kasi hindi po from province, bali dumadaan po kami sa BARM.
That's really, yeah, that's quite peculiar because I understand most of the district hospitals, like in our case in Batangas, it's a province who already administers the budget. So this is different. It comes from the region, sa BARM po mismo, because you're under BARM. So it's under BARM. Okay.
Mr. Chair,
yes, go
we
ahead.
would like to clarify that in our case, we are non-devolved as compared to other provinces in the Philippines. We are devolved to BARM.
Okay. So to clarify, all of the district hospitals within the jurisdiction of BARM, your devolution is not to the district or not to the district, not to the province, but to BARM.
Yes, po, Mr. Chair.
Okay, thank you. Well, okay, I get, yeah. Yeah, and discussion and reconciliation, how to administer this. Okay. Yes, Congressman Roque.
Yes, Mr. Chair. I would like to make a motion, considering all the inputs that we got in the deliberation. I'd like to make a motion for House Bill numbers 1358, House Bill number 1359, and House Bill number 1369 be approved, subject to style and amendments, Mr. Chair. I so move.
On the motion.
Thank you. There's a motion to approve House Bill number 1358, 1359, and 1369. And Juliet seconded. The motion is approved. Thank you. Thank you. Congratulations. Just a point of clarification also that COMSEC has brought up. With the DOH, is there any coordination with the Ministry of Health in BARM with regards to appropriating the funding for these? Or has this not yet been administered, or no discussion yet has taken place? Just so that the committee is enlightened with regards to your process.
Thank you, Mr. Chair. Unfortunately, I don't have the information right now, but we will coordinate closely with the committee secretariat once we get that information from our UHC Health Services Cluster team. Thank you, Mr. Chair.
Thank you. Yes, this committee would be expecting this report. Thank you. Okay, let's move on so we could finish. We have next for deliberation is House Bill number 9832 entitled An Act Establishing the Municipality of Panglao, Province of Bohol, a hospital to be known as the Panglao Island Medical Center, or PIMC, and appropriating funds therefore. It is authored by Representative Chato, but I believe Congressman Bulut Begtang is here to sponsor the measure. Congressman Bulut Begtang.
Thank you, Mr. Chair. May I move that the explanatory note be sufficient to defend this House bill?
Thank you, Congressman Bulut Begtang. Yes, given that, let's recognize some of our resource persons. I guess we start from the DOH. Mr. Cruz, again.
Thank you, Mr. Chair. With regard to House Bill number 9832 on establishing the Panglao Island Medical Center, based on the proposed position paper that will be signed by our Secretary of Health, it states that we are supporting the establishment of the Panglao Island Medical Center, provided that the hospital shall be under the direct supervision and control of the province of Bohol. But in so doing, the DOH through the Central Visayas Center for Health Development will be continuing its provision of technical assistance and monitoring to the compliance of standards according to the Philippine Health Facility Development Plan. And this in brevity is the contents of the position paper, which will we submit to the committee secretariat once it is signed by our Secretary of Health, Teodoro J. Herbosa. Thank you, Mr. Chair.
Thank you, DOH. I guess I'd want to hear also from the DBM if you have any thoughts on the matter. I'm since given this is an appropriation, or is there any insight?
Magandang tanghali, Mr. Chair. As to the proposed measures on local hospitals, we defer to the DOH on the matter, considering that this their coverage. Thank you.
Thank you. I'd like to ask also, given DOH, I'm not so sure if there is already an existing program here of a multi-specialty medical complex in Bohol. Is this under the DOH also, or is this under the province?
Mr. Chair, the Governor Celestino Gallares Multi-Specialty Medical Center in Cortez, Bohol is under the DOH supervision and control.
Okay, thank you. I see. All right. Well, if there any, we'd wish to open the floor to any of our House members that wish to seek clarification. If
Mr.
not,
Chair,
yes.
kasi parang it was stated by the resource speaker of the OH that it should be under the provincial government supervision, but in the law, in the bill, it's stated under section 1 that it should be under the direct control and supervision of DOH.
Okay. Yeah, I believe that most of these proposed measures also is the author's intention is that it's under DOH, but I believe that DOH position here is that the operation is going to be with the province, given that with the devolution by the Mandanas ruling. So I believe for this, normally it's the capital outlay of the establishment that DOH is going to be funding. Is this correct?
Yes, sir, Mr. Chair, through our health facilities enhancement program, we can in fact accept based on the soon mandate, we will be able to help in establishing the capital requirements of the new hospital.
Mr.
Yes,
Chair.
Congressman Roque.
No, I would understand that we can rely on DOH with the HFEP. We can rely on that. Pero every time they keep on telling us about the devolution into the funding for the province, okay lang yan. If the national will provide for that budget in the province. Right now, the current status of the province can only supply for what is needed in the province currently. Buti sana kung lalaki yung budget ng province. Specifically, for the installation of that hospital that we have been proposing, 'di ba? Paano maghihingi tayo kay DBM? Dapat si DBM bigay niya na yun kay province, specifically earmarked for that hospital that we are requesting. Okay lang yan, sabihan mo kami, because of the Mandanas ruling, de-devolve ka para sa province, okay lang yan. Province will allocate it for us for that specific project, considering na binigay na yan from the national. Hindi yung pondo ng probinsya, sorry nasa amin din yung probinsya, pondo ng probinsya, babawasan mo pa na kulang na nga yan para sa probinsya. Okay lang yan kung madadagdagan mo para dyan sa project na yan. Walang problema sa devolution. Kung wala kang ibibigay na, di ba, kulang na nga yung funding ng province, hindi mo pa binigyan from the national, paano magiging magte-take effect yung mga bills natin regarding the hospital establishments? Yun lang po, Mr. Chair.
Yeah, it seems that the conflict that we have here is there seems to be that nauna yung function na na-devolve for the funds. And I think this is something that is still being clarified also on, I believe that the devolution policy and the methodology of this is being rationalized again. So it's still, given that it is still pending its reinterpretation of how to execute the Mandanas ruling, we actually have to just go through this measures altogether where DOH could actually provide for the capital expenditures, and then the province has to shoulder the MOE and the PS of these hospitals. This is correct. Sometimes even the capital outlay the province has to shoulder also, given the urgent need. Okay. Well, the province should get the fund from the national. Nakatingin sa akin yung DBM. He's like wondering really when it's supposed to go. But yes, does DBM have any feedback or insights with regards to the implementation of the Mandanas ruling already?
Mr. Chair, as far as I know, wala pang instruction from the OP, no? So ang pinakahuli kasi ay really to study the devolution plan, considering that there are sectors that are really reacting on it. As to what we're discussing right now, si DBM naman po ilalagay niya yan sa panukalang batas, sa tapurbahan po ng Kongreso. So kami naman po itatalima. Bagamat kami po ay kaisa po ng posisyon po ng DOH, as much as possible, nasa local government sana yung operation yan. Tama po, meron pong HPEP. Hindi naman po laging sasapat ang ating pong budget, pero kung pong ito po ay maipaplano po ng tama, sa tingin po natin magagawa naman po ito ng pakonti-konti. Pero gayon pa man po, mas nasa inyo pong wisdom ang decision mo sa bagay po na ito, sir.
All right. Thank you, Mr. Moreno. So, in other words, we're still studying the rationalization on the implementation of the Mandanas ruling until now. Wala pa tayong instructions from the executive branch on how to properly implement it, or the budgeting, or the new rationalization implementation of the Mandanas ruling. Okay, thank you.
Mr. Chair,
Yes.
can I just ask kung ang province of Bohol ba meron ng national hospital?
Yes, Mr. Chair. In answer to the question, yes. DOH retained hospitals in the province of Bohol is currently ay 3. So may 2 po tayong Celestino Gallares, one in Tagbilaran, the others in Cortez. And the other one is in Ubay, Bohol, yung Don Emilio del Valle Medical Hospital. National hospitals po lahat yun. Hindi po.
Yes.
Mr. Chair, can I move for the approval of the...
Yep.
Ay, sorry.
You'll have to.
Mr. Chair, may I move for the approval of House Bill number 9832, including its committee reports soon as the Secretariat is able to provide for it, and also subject to style and amendments. Mr. Chair, I so move.
Do I hear anybody to second? Okay. Thank you. There is a motion to approve 9832, duly seconded. House Bill 9832 is approved. Thank you. Congratulations. And then we have last, thank you for your patience. We'll be deliberating now House Bill number 10035, entitled An Act Establishing in the Municipality of Tubao, Province of La Union, a basic comprehensive specialty center to be known as the Tubao Mother and Child Specialty Center, and appropriating funds therefor, by Congressman Dante Garcia.
Thank you, Mr. Chairman. In the interest of time, I move that the explanatory note of House Bill number 10039, establishing a Mother and Child Specialty Center in the Municipality of Tubao, Province of La Union, be injected into the records as my sponsorship speech. I would just like to emphasize, Your Honors, that the proposed legislation shall cater to the health needs of a significant number of populace in surrounding municipalities too, especially in life and death situation where every second counts. The nearest health facility, the Ilocos Training and Regional Medical Center, which is located San Fernando City, is about 39.9 kilometers or barely an hour away. Thus, I would like to entreat and support of this honorable committee for the immediate approval of House Bill number 10039. Thank you, Mr. Chairman.
Thank you, Congressman Garcia. I guess we now hear from our resource person, again from DOH, I believe Mr. Glenn Cruz.
Thank you, Mr. Chair. If it so be allowed by the chair and the committee, I would like first to also hear from the Ilocos Center for Health Development Regional Director, who is here to also give her insights.
Yes, Director Sidjonkot, you're recognized.
Good morning, everyone. First, to complement the recommendation of HFDB later on, the following will provide for the technical evaluation. So, for the bed to population ratio, generally the latest bed to population of the province of La Union is 1:1005, with a total of 844 total inventory of hospital beds to cater 848,304 by the population of La Union. This is, of course, greater than the WH standard, which is 1 is to 800. Further, in the Philippine Health Facility Development Plan of 2020-2040 to 2040, we now have a new computation of gaps of hospitals. It should be according to the level of care. So if we look into the level of care of level 1 for La Union Provincial Hospital, we have a gap of 712 beds. For level 2, we have a gap of 680 beds. And for level 3 hospital at 354 beds by the year 2025. So the nearest hospital is the La Union Medical Center, a level 2 hospital, which is in Aguo, but this is managed through economic enterprise, which suffered a lot during COVID. So, nahihirapan pa sila sa income nila ngayon because of the COVID. And of course, the nearest DOH hospital is the Ilocos Training and Regional Medical Center, which is 13.9 kilometers away. Looking into the contribution of reducing the maternal and child health, according to the latest trends of our FHSIS, we have markedly reduced the maternal deaths from we have 200 maternal deaths per 1,000 in 2019 to 47.11%. That's at the regional level. However, comparing to the different provinces in Ilocos, La Union remains to be challenging with regards to maternal care. This is also same as in neonatal death, as well as the infant and under 5 mortality rate. In fact, our under 5 mortality rate is 22 for 2023. So aside from this, we have identified La Union as the highest for road traffic injury and in drowning. As we have noted, usually it's the vacation area of the people from Manila. Doon sila surfing, swimming, and all those. So, umi-increase din yung tourist namin doon. So, for the catchment population of this Tubao, it's 211,204 for the 2023 population. Other relevant information for Tubao is just a 4th class, but it's a landlocked municipality in the province of La Union. In 2023, it has a population of about 32,000. Currently, it has only one primary care facility that caters its whole population, and those residing in the borders of the LGUs Aningay, Agoo, Santo Tomas, and Pugo. In addition, the municipality is dissected by the National Highway. The proposed health facility may offer medical tourism services in instances that passing and sojourning tourists may encounter health problems. It also serves as the nearby barangay of San Pascual of Tuba, Benguet. Diretso kasi ito sa Marcos Highway din. So, going to Baguio. So, in view of the foregoing, the proposed establishment of the health facility will be an integral part of providing basic, comprehensive, and quality health services to all the citizens of the municipality and the province as a whole, as well as our tourists. It is also critical to closing the gap of the hospital beds in the entire province of La Union. Be as it may, the office recommends not only a mother and child, but rather a level 1 general hospital. But of course, we need to specify the ownership or management of the bill to clarify sources of funding to its capital investment, manpower, and request for operation. And as Congressman Roque has said a while ago, hirap na nga yung probinsya. So, I guess we might see other options like DOH. Thank you.
Mr. Chair.
Thank you, Dr. Zidonko. Yes, Mr. Cruz.
Yes, sir. Thank you, Mr. Chair. With the rejoinder that the proposed position paper of the Department of Health in this consideration is that it is consistent with the observations of its regional office in Ilocos that that there is a hospital capacity need that has to be filled in this district, in this area of Tubao, but that we are also seeing that the specialty on the mother and child specialty can be best invested in expanding the specialty capacity of its regional hospital in La Union, which is ITRMC. Given that there is actually a basis for implementing the Regional Specialty Centers Act as legislated in that area, but we recognize the fact that a general hospital level 1 capacity might be necessary in Tubao. Thank you very much, sir.
Thank you, Mr. Cruz. We open the floor now to our members who wish to interpolate. Or Congressman Garcia, would you wish to say a few words regarding this or any other questions?
Mr. Chairman, just a minor correction on the numbering. It is 10035, not 10039. And as a comment, I'd prefer a mother and child specialty hospital.
Thank you.
Mr. Chair,
Yes. Congressman Roque.
may I move for the approval of House Bill number 10035, subject to style and amendments, Mr. Chair.
There's a motion to approve House Bill number 10035. Juliet seconded. The motion is approved. Thank you and congratulations. Are there any other matters?
Meron
Okay.
yata akong other matters, Mr.
If there are no
Mr.
other
Chair?
further matters, yes?
Other
Congressman
matters.
Yes, Congressman Roque.
Question kay Mr. Glenn Cruz.
Go ahead.
Mr. Glenn Cruz, meron bang national hospital sa province of Bukidnon?
Mr. Chair, opo. With the province of Bicodnon, wala po.
Duly
The
noted.
nearest DOH hospital for the province of Bukidnon would be the Northern Mindanao Medical Center, which is an apex hospital located in Cagayan de Oro City.
Thank you, Mr. Glenn. Mr. Chair, NMMC is about more or less 150 kilometers away from our place. And it has been this representative's bill to create a national hospital in our province, which is still pending as of now, ang bill namin. So, maybe, Mr. Glenn, pwede natin pag-isipan yung National Hospital ng Bukidnon, 135 to 150 kilometers away. Ngayon, the passport, DFA, consular office has already been approved for our place. Kasi sa sobrang layo, nasa malapit lang sa NMMC. Paano naman po yung national hospital namin na wala kami kahit na isa? Puro provincial, puro maliliit, puro private hospitals. Paano naman ang mga mamamayan na hindi nakaka-afford ng private hospitals? Mr. Chair.
Thank you, Congressman Roque. So I guess what she's insinuating is isama nyo daw sa HFEP ninyo. That, yes, it will be included already in your development plan, I guess. Okay.
Thank you, Mr. Chair. To respond lang. We recognize that there are certain House bill and legislative measures that's being proposed with regard to the province of Bukidnon, and ones that the committee has or organized and called for the hearing, we will be responding as you request. Thank you.
I believe we've passed it here in the committee, and it's in the Senate. It was
My
devolved.
same bill with the same reaction and comment of DOH with our hospitals proposed today. Same comments from the DOH. It will be devolved to the province. Pero until now, wala kaming national hospital. And the province cannot support that. Including yung mga other funds na kakailanganin, di ba? Dapat ibibigay sa province eh. But because hindi pa natin alam ano nangyayari sa devolution. Yung funding is still questionable. So, I want to know how will they solve provinces like ours na wala talagang kahit na isang national hospital?
I guess we do have to. Yeah, maybe there is this recommendation if you could reconsider changing your position on the matter so that we could already include the national hospital. But so it's a part of it's already passed in the committee. We've taken it up on the floor, haven't we? Okay, on the committee level. Okay, so there is. I think there is an automatic referral on the appropriations, given that it's an appropriation of funds. Yes.
Thank you po.
Yes.
I-coordinate po namin yung panawagan po ng committee to the proper authorities. Thank you, sir.
All right.
Salamat, Mr. Glenn. Salamat, Mr. Chair.
Okay. I guess we've tackled all of the bills here that is on our agenda today. We've had other matters. Again, we'd like to thank all of our House members for going through this, joining us in this meeting, to all of our resource persons for providing their valuable insights and opinions with regards to the implementation or the deliberation of this bill. Thank you very much to our ComSec and to all of our staff for helping us in the execution of this meeting. So if there are no other matters, any motion to adjourn?
Mr. Chair, I move to adjourn this hearing, Mr. Chair.
Okay, there's a motion to adjourn. Julie seconded. The meeting on the Committee on Health is now adjourned. Thank you very much.